Kia ora, ko David Jansen tōku ingoa, he rata ahau e mahi nei I Tāmaki. I'm GP, I'm working in Karangahape Road in central Auckland, and I've got a clinic in Mount Smart as well. In the last few years, scientists have identified another version of the flu virus, and it looks like it's going to be a really high risk of affecting lots of humans. And that's really a big worry for us.
My name's William Ranger. I'm a public health physician. That's a doctor who looks at the health needs of populations or communities of people. For the last couple of years, I've been working with the district health boards in Auckland and Northland, helping them to get ready for a potential serious pandemic situation. Every year, people get influenza, and that's caused by an influenza virus. Pandemic influenza, by definition, is something different. It's caused by a similar virus, but it's a totally new virus, and so there is no immunisation for it. The scientists and experts should be able to develop a vaccine for it once the pandemic strain emerges, but that will take a few months. So the first wave, or the initial hit, there won't be an immunisation response for it. It is most likely that as it changed to be able to go from person to person, it would lose virulence, it would lose its severity. It wouldn't have a 50% mortality rate associated with it. It would be less than 5% in all likelihood. Very much smaller percentage of fatalities among those infected. But the numbers of people infected would still be huge, and so we still would be talking large numbers of dead people if it was of that seriousness.
Pēne te pātoku ko toku mahi ko neina te kaiwhakahaere Maori mō te tari hauora o Tāmaki ki rau. Well, we've got a population of 460,000, so you'd be looking at well over 230,000 who could be affected by it directly. When you think of it from a Māori perspective, you're probably looking at about 40,000 Māori being affected by it in the Counties Manukau area. There'd be a huge change in terms of the face of how the community functions. You know, very simple things. I mean, public transport won't run on time. That may not be a new thing, but that won't run on time because, you know, half the staff are off. Simple things like the dairy not being open, Pack and Save not being open, those are going to be a reality because there's not going to be enough people to staff them. You know, and even more importantly, there's potential that things like banks and that are going to be closed. You know, the money machines won't have been filled up, so all of those things have a potential to hit us.
Okay, I'm Steve Brazier. I'm the National Coordinator for Emergency Planning in the Ministry of Health. I'm responsible for putting together the pandemic plans of the Ministry and the District Health Boards and for other government departments. We're working on about 40% of the population getting sick. And not just sick with a bit of a snuffle, very sick. So you find that most households would have someone off, ill in bed, and most families would have to be looking after someone at home who's sick.
The highest risk will be when we go and meet with other people. So schools, factories, workplaces, hui at the marae, all of those will be high risk activities. And we'll need to make some really important decisions about which ones of those things we continue to participate in, and those things that do carry on may be modified.
You might have the situation where people will want to get away from where they're currently staying, especially if there's a quite concentrated outbreak. They'll want to get away to another part of the country to be able to, you know, feel that they can live a bit more safely. So marae could be called upon to host the whānau back in their papakainga. And I think that that's really important that they consider how that might be managed. I think we have to be really careful and thinking quite a bit about the sort of pressure doing something like that would put on our papakainga. You know, when you think about the role of tangihanga, that happens over a sort of a 3-day, 6-7 day timeline. and it's about dealing with an intensive situation over a short but very finite period of time. So, you know, our whānau are champions at doing that. You're talking about the potential where people might have to come back for a few months. And if that's the case, then we can't just turn up one day in the car with the whānau in the back and say, hey, we're here, you know, we've escaped the bird flu, we're alive. You know, we'll only be here for 6 months. You know, that's really unfair on our whānau. So we've got to be thinking about, okay, if we're going to go through that process, what are the things that we need to be taking with us? How might it be that we prepare our papakainga for that potential of outcome?
My advice is that every community should talk about it, and talk about it now before we have that problem immediately on our doorstep. This one kaumata was telling me about, back in the day, something had happened to their marae, and they cut down a tree and blocked access to their marae. And that's what they're going to do if this pandemic happens. I said, well, that's a good idea, but just tell me, what would happen if on the other side of that tree, that's your moko, and your mokos have come all the way from Wellington, and they're now just down the road from you, and they're well. And they're saying, hey, come on, Papa, we're well, we haven't even got the disease, we're trying to get away so we don't get the disease. What are you going to do then? And he just kind of indicated in the sense that you would. Well, of course, if your own mokopuna are there trying to come back to your marae, that you really want them to come and join you. Okay, so the reality is that lots of Māori will leave the city. Lots and lots of Māori. We know that from research, that lots of Māori are saying that if this thing happens, hey, I'm just going to go home. I'm out of the city, I'm going back bush. Okay, well, we need our communities back home to have had that discussion, because I think chopping down the tree is still a fine idea, but we need to make sure that it's maybe somewhere where they could stay for a few days, and those who are not affected by the flu could stay for a couple of days, and then if they're fine after a week, they move on and join us who are not touched by the flu, and then those who are sick get some support down there near the chopped down tree.
We're down in the National Crisis Management Centre, which is under the Beehive. This operates during a civil defence emergency. If we had a pandemic, then it's probable that down here we'd set up in the National Health Crisis Centre, which is the centre for running the most of the parts of the government which will respond to a pandemic. The strategy we have for running a response to a pandemic is in 4 stages, really. There's the bit where we plan for it, and that's what we're doing at the moment pretty busily. Then if it looks like there's a pandemic approaching, and we'd pick that up through a variety of monitoring places overseas. If it was approaching, we'd have the keep it out phase, where we'd do whatever we can to keep it out of New Zealand, and that could include border closing, restricting entry to people from certain countries, assessing people that do turn up to see if they've got anything which looks suspicious. If it slips into the country, and it's pretty hard to keep out, if it slips in, we'd be into what we call stamping it out, which is we get an outbreak in a particular area, and you ring fence it. You try and keep in that area, don't let people out of the area, give them antivirals, and it's the old-fashioned method that's been used for hundreds of years. In your local village, if you got sick there, you'd try and keep yourself safe by isolating a village from other places. If it got worse than that, then we'd be into the managing it phase, where if you had a widespread pandemic, there's a range of measures we'd bring in around things like, for example, closing schools. Maybe if it got really bad, prohibiting public gatherings, closing some social centres like pubs and cinemas, things like that, where people gather together and put themselves at risk. If it got worse than that, maybe even looking at putting up what we call internal borders and stopping people moving from one part of the country to another. It all sounds pretty primitive, but it's worked. It's worked for human beings for hundreds of years.